Since we are 4 minutes past, let's go ahead and get started. Good afternoon, everyone. Thank you so much for joining us. We recognize that it is, the afternoon of Halloween. And so many of you are probably thinking about your plans later this evening or just waiting to go give out candy. But we're so very thankful to have you join us for this important session. So it's my pleasure to welcome you to our session on addressing health equity by simplifying digital health information. And we'll talk a little bit about the next edition of Health Literacy Online. As we begin the session, I'd like to introduce myself. My name is Jennifer Ann Bishop. I am the director of the Division of Health Promotion and Communication at the HHS Office of Disease Prevention and Health Promotion. Thank you, Janelle. I'd also like to introduce Ms. Blythe Miller. She's our subject matter expert in plain language, and she works with Communicate Health. And you'll learn more about both organizations shortly. And last but not least, I'd like to introduce Dr. Janelle Shu, subject matter expert and research and evaluation with Communicate Health. Next slide. So as I mentioned before, I just wanted to give a little bit of background on the Office of Disease Prevention and Health Promotion. Our office sits within HHS in the Office of the Secretary and also within the Office of the Assistant Secretary for Health. And we are tasked with encouraging all Americans to lead healthy and active lives. And we accomplish this through multiple means, including creating and promoting national health priorities. Some of you may be familiar with Healthy People, for example, but we also translate science into policy and create guidance and tools. And accessing or addressing health equity is truly a priority for our office. We use health and health equity lens with all of our work, and that focus underlines our commitment to ensuring that people have the tools and resources they need to, whether they're consumers and looking to address health literacy or improve their own health literacy, or organizations that are looking to ensure that they are communicating clearly with their consumers. Our office is among the leaders within the Department of Health and Human Services related to promoting health literacy. And on the slide, you see just a few of the activities that we do to support the health literacy initiatives within HHS. So the first, we lead the HHS Health Literacy Work Group, and that work group seeks to ensure that we are coordinating across the department to ensure that health literacy remains a priority for HHS, and we're also sharing best practices. The office also houses Healthy People 2030, and you may be familiar with this program or this initiative where we set national public health objectives, including those intended to address health literacy. And most recently, we launched the new two-part definition of health literacy that addresses not only personal health literacy, but also acknowledges the role of organizations in addressing health literacy. We also created a new video that defines 4 key critical things to know about health literacy. And please go on to healthypeople.gov to take a look at that. We also have the My Health Finder tool, which is an easy to use health information guide that helps identify and promote clinical preventative services that everyone should be taking advantage of. And we have a tool that allows you to personalize your recommendations just based on age and gender. And this is a tool that we also like to promote to healthcare providers so they can engage with their patients. And last but not least, we have developed our Health Literacy Online, and this is a digital tool that offers guidance on creating digital health products using the best health literacy practices. And there's going to be more on that in a bit. Now, we don't do all of this work by ourselves. We have our partner and colleague, Communicate Health, help us execute all of these activities. So I just wanted to hand the virtual mic over to Blythe Miller to tell a little bit more about Communicate Health. Next slide.
Perfect. Thanks so much, Jen. Welcome once again, everybody. We're so happy to be here. And I'm just going to tell you a very short amount of information about CH and then pass it back over and we'll get into the meat of everything. But Communicate Health is a mission-based, woman-owned, LGBTQ plus owned health communication firm that specializes in health literacy. And now we're really focusing, and we'll talk more about this, but on that key intersection of health literacy and health equity. So our focus is on creating health information that is easy to access, understand, and use. And we think a lot about how we can address, what is ultimately a pretty problematic mismatch between the skills and abilities of our audiences and the demand of often extremely complex health information and related products and services. So at CH, we are a team of writers and designers and social science researchers, developers, health educators, user experience designers. We really run the gamut. And some of you might know us from our blog and newsletter, the company called We Heart Health Literacy. And we share health literacy focused tips for public health and health communication professionals through that. So sometimes that is a good recognized. And I will hand it back to you, Jen.
Great. Thank you so much. So we have an action-packed agenda for this afternoon. In our session, we are planning on talking about health literacy basics, providing you with some more information on digital health literacy. And then we're going to introduce health literacy online, and then also engage you in our breakout activities to help you help us with our upgrade of version 3.0 of health literacy online. But before we do all of that, just wanted to have an icebreaker. Next slide, please. So please put your answer in the chat and let us know if you could choose any person from history to be your imaginary friend, who would it be? And so please just go ahead and put your comment in the chat. We're really excited to see who everyone's imaginary friend would be. And I don't see any messages in the chat yet. Jesse, there we go. We have Jane Austen. We have Alexander Hamilton. Would you go see Blythe? Would you go see the play or the Broadway show with Hamilton?
Absolutely. What could
cool.
be more interesting than that?
Absolutely. Who else do we have? Amelia Earhart. Love it. Personally, I'm a fan and a rabble-rouser of Ida B. Wells, so I would choose her. We have Margaret Mead. Thank you. Abraham Lincoln. Love it. Who else? And also, don't forget to tell us why. I'm interested. Okay, Julie Cox, Toni Morrison. Love it. What a great author. Any final additions? And I love the engagement. We can definitely like and love each other's comments. Okay, so we have a distinguished list of imaginary friends. Actually, would love to have a party with all of these friends. I think it'd be kind of cool. So our next question for you, and I know that some of you are still warming up, but we really would like you to help answer this second question. So please answer the following question by typing in option 1 and option 2. And the question is, if you had to choose, which of the following best describes your work in health literacy? Option 1, I spend more time applying health literacy best practices. And option 2, I spend more time researching or developing best practices. And we have some folks who are just jumping in there. Thank you so much. Oh, we have a lot of those who are doing application, lots of application. Great. Anyone out there doing research? Okay. So this information is super helpful for us. We have some who are doing research and application because I think it's going to help inform some of our breakout sessions. So I think we're warmed up. Keep your feedback coming as far as how you engage with health literacy. And I'm going to hand the virtual mic over to Blythe again, who's going to start talking a little bit more about health literacy basics, as well as our our health literacy online tool and digital health. So Blythe, please take it away.
Wonderful, thank you. Go ahead to the next slide, please. Great. Okay, and I'm acknowledging right up front, I'm gonna kind of cruise through some of this, since I imagine that most of you are pretty familiar with some health literacy basics, but we do want to set the stage for the activities that we're doing today and to talk about that resource that Jen mentioned. So we are gonna talk through some health literacy basics. So this definition of health literacy should look pretty familiar. Health literacy is typically defined as a person's ability to access, understand, and use health information. And we know that issues related to health literacy affect a lot of people. So we're very used to seeing the framing about specific groups that are more likely to have limited or low health literacy skills. So we talk about older adults, sometimes people with limited education, people who speak English as a second language, just to name a few examples of those audiences that we've traditionally talked about as having low or limited health literacy skills. But the truth is that health literacy is situational. So at CH, as we like to say, it is a state and not a trait. So anybody can struggle with health information in a particular situation. Even people with super, super high baseline skills can have trouble processing, can have trouble retaining information when they are sick or stressed or scared. And these are all things that are often true, right, when people are interacting with health information. Next slide, please. And so that's a nice segue to a change we've seen a bit in the health literacy world. So there has been a real and long overdue, I would say, shift in the way that we talk about health literacy over the past few years. So at CH and as a field more broadly, we've really moved away from that kind of framing of an individual deficit, right? People have limited or low health literacy skills. So moving away from that and rather toward defining it as a systemic problem and recognizing that health communicators, people like us, have to do better creating the information in the first place or creating the digital experience in the first place. And that's what gets us to what we call organizational health literacy. And as Jen mentioned, the ODPHP's Healthy People 2030 initiative has rolled out this new two-part definition. So in addition to the way we talk about a person's ability to access, understand, use, we also want to talk about how well organizations are equitably enabling people to access, understand, and use information. So we've really arrived at a two-part definition, that more traditional personal health literacy framing, and then this acknowledgement of the real systemic nature of the problem. Next slide, please. And another thing you've probably all heard a lot more about in the last few years is the connection between health literacy and health equity, right? So we know that there's an important link here. When we use health literacy best practices, when we think about things like organizational health literacy at our workplaces, we break down one barrier to good health. And of course, we cannot achieve health equity, via communication alone, but it is one really important step toward addressing some of the longstanding inequities in public health and in healthcare that have really remained. Next slide, please. Great. And so let's talk a little bit about digital health literacy. There are lots of types of health literacy, as we're learning. And so as we know, everything is online right now in our climate, and health information is certainly no exception. So digital health literacy, when we talk about that term, we're talking about the skills that are necessary to successfully navigate and use digital health information and resources. And if you think about the kinds of activities that are happening online in the health space, these are pretty high stakes things. There are, a common digital experience would be signing up for health insurance or signing up for a Medicare plan. People are using patient portals to view test results, all of these kinds of things, and they're pretty important, right? So digital best practices like usability, accessibility, and we're going to get to a lot of that, are really critical to apply to health information, because when that doesn't happen, consumers have real problems. So I'm going to zoom through a little bit of an intro to a few of these sort of key digital literacy topic areas to help us set the stage for some of the practices that we're talking about, because health literacy online, which we'll get to, goes beyond tips, like how to write in plain language, and really drills down into things that are specific to the digital product design and digital product environment. So things like creating intuitive navigation labels, for example. Next slide, please. So we hear the term usability thrown out a lot, but what are we really talking about? So usability is a quality attribute that assesses how easy user interfaces are to use. And the word usability also refers to methods for improving ease of use during that design process. And you can see the 5 main components that make up usability on the slide. So we're talking about things like efficiency of completing a specific task. Are users able to complete key tasks without errors? If they do make an error, are they able to recover from it quickly, and so forth, that kind of thing. So very important. Next slide. And another key consideration here is, of course, accessibility. Because before we can even get too far along in the usability conversation, we need to make sure that our users can access our website, our product, our service, right? And there is legal incentive here too. Section 508 of the Rehabilitation Act requires that all federal digital tools are accessible to people with disabilities. Another thing that you might hear about in this space are the Web Content Accessibility Guidelines, and those capture federal standards for accessibility. And, when we talk about accessibility, I think is another one of those terms that is thrown around a lot. And so when we talk about creating an accessible digital product, what do we really mean? Well, it means making products or services that work for as many people as possible in as many contexts as possible. And that can look like a million different things. A new parent who might be holding a newborn while trying to find health information or look for something online, or somebody who is blind and uses assistive technology like a screen reader to navigate the web, right? So lots of options for ways this could play out in real time. Next slide. And another key principle that we'll be looking at as we really start to hone guidance for the next iteration of health literacy online is inclusive design. And inclusive design builds on accessibility considerations and really takes into account all of the diverse, for lack of a better term, diverse types of diversity, as you can see on the slide. So thinking back to health equity and the framing, that intersection of health literacy and health equity, that is a world in which everybody can use the products and services, particularly these products and services that are related to key health decisions. Next slide. And so putting all of this together, and I realize as I said, I'm kind of zooming through these key concepts, but it will all, I think, make sense in context. But everything that I just went through as a backdrop, with that as a backdrop, the main takeaway here is that public health professionals, health communication professionals, folks like us, we really need to understand how to create and design and build digital products, digital services in the health sphere that really work for everybody. That is an equity issue squarely. So, and that gets us to the resource that we'll really be focusing on today, and that is ODPHP's Health Literacy Online. So next slide. Great. So the first edition of Health Literacy Online was published by ODPHP in 2010. And it was based on ODPHP's original research with a ton of users with limited literacy and health literacy skills, plus the, pretty small, I would say, body of literature that was available at the time on web experiences of people with limited literacy skills. That is something we have some more literature to pull from now, but in 2010, there wasn't too much. So it was really interesting and wonderful that ODPHP had so much original research to use. And I think it really helped put this resource, make this resource a real flagship product. It was really there wasn't much like it of its kind. And it was designed for anyone who might be involved in the creation of digital health website or digital health information tools. So that could be writers, developers, user experience designers, and so forth. And obviously, some parts of it might work better for certain audiences, depending on where you come in on the health information creation lifecycle. But I think that's an interesting thing about this resource, is that it really can be appropriate for a bunch of different disciplines. Next slide, please. And then in 2015, ODPHP launched the second edition, which was based on updated research. The second edition also included some new topics. For example, considerations for mobile users, right? And when Health Literacy Online was first launched in 2010, we had a lot of people who mostly used the internet on desktop computers. That is no longer the case, of course, as we all know. So the second edition included mobile considerations, and also drilled down into another topic that I think is really interesting, which is tips for actually involving people, your users, the people with limited literacy skills, in the creation of digital health information tools. So that was kind of a unique space, I think, especially for that time. Next slide. And this brings us up to date. So here we are. A lot more has changed since 2015, right? Seems like things in all the places seem to change faster and faster. So ODPHP is currently working to update Health Literacy Online with the latest best practices in areas like accessibility, numeracy, plain language, inclusive language, all of these great things that we talk about when we look at really the equity, look through the equity lens at these kinds of issues. And in developing and in drafting the latest research-based guidance on all of these topics, ODPHP is really using that health equity lens. And this resource will definitely stress, even more than it already does, the important link between health literacy and health equity. Next slide. And so with this latest guidance, ODPHP is looking to really move the needle in terms of the inclusivity of digital health information that is available, and also to equip professionals with the information they need in a format that they can easily digest and use. And that's where we get a little bit meta. But what do we need? What do you need to apply health literacy best practices in your daily work? And that is where you come in. And I'm going to turn it over to my colleague Janelle to introduce our breakout activities.
Hi, everyone. I am really excited about our workshop today, and especially for this part. We really would like to hear from you. And so we are going to break into smaller groups for feedback discussion. And this was a key component of why we proposed this workshop, is to really be in conversation with you. So we're going to do the breakouts. Our tech person is going to help us with that. And then we will come back together in about 25 minutes. Before we do that, does anybody have any questions? All righty, so let's go ahead and do the breakouts.
All right, I'm just gonna check on our other group. They should be coming back. And we're just gonna wrap up in these last few minutes.
Hey, everyone. It's great to have you back. There we go. In our last couple of minutes, I just wanted to regroup and share out Blythe or somebody from breakout group number 1. I'm curious about what kind of rose to the surface, what stood out to you in terms of when creating digital health information or products to align with health literacy best practices, what are key barriers that you talked about or key facilitators?
Does anybody from the breakout room want to share directly? There were some really good ones. Okay, well, we had a lovely discussion about a lot of different things, actually, touched on many different things. But in terms of some key barriers, we definitely talked about buy-in from different people, and whether that is, leadership or whether that is collaborators. It sounds like we had some folks who work collaboratively, as many of us do, in a bunch of different ways. And so maybe somebody is doing one part of a project, and then another team is coming in. And so when everybody's not on the same page about the importance of health literacy and taking the time, using the resources to really apply these best practices, that can be a major barrier, even if you have, people or a full team, frankly, within your organization who are devoted to it, right? We still can run into trouble there pretty easily, I would say. We also talked a little bit about how there is not a ton of updated health literacy data, which I just thought that was not so much a direct response, but I thought was a really interesting conversation. And I was wishing for Jen and Janelle to be over in our applying breakout to talk a little bit about that. But it sounds like that can be a pain point too. People are not always having, don't always feel like they have the information and the resources to make the case for health literacy, which is a very important thing. And then, we talked a bunch of things, like I said, but I'll round out and just say we were talking a bit as well about somebody in the breakout who has created health literacy standards for her own organization, and how helpful it can be to have those kinds of streamlined things captured and documented to share with not only internal folks, but also collaborators, other stakeholders. And we talked a little bit about how maybe health literacy online can help potentially fill some of those gaps for folks. So that's a very high level summary.
Thank you. I really, I wish I could have been in two places at once. For the second breakout, we were talking about different topics that the new edition of Health Literacy Online might address. And we got into some really neat details around transcreation, around search engine optimization, including the impact that, what's it called when they finish what you're typing? It's LLM, and how that might direct people's searches in ways that it wouldn't, their search might not have gone if the machine hadn't been prompting them. And as I was typing my question in chat here, that came to mind as it was completing my sentence for me. We get so used to it.
And we also there was a lot of discussion or interest in learning a little bit more about how to appropriately present numerical information, since we know that people struggle with that, particularly fractions. So that was something that I think a few of our respondents were really interested in hearing a little bit more about. And if you haven't already, we would love for you to also put in your go-to resources in our chat. And I will hand the mic over again. Sorry.
Oh, no, thank you so much, Jen. I wanted to share out as a wrap up that there is an email list where you can get health literacy related alerts from health.gov. You can sign up for emails from Communicate Health. And if you're interested in being part of usability testing related to health literacy online, you can send an email to odphp@communicatehealth.com. And you can also use that email address if you want to share any additional resources, if there are topics that you want to suggest that Health Literacy Online cover in its next iteration, or any questions you have for us. Now, I know Michael had to step off, but he wanted to invite you all to go to the closing session, which starts right now. So thank you so much for being here. Blythe, Jen and I, we cannot do this without you. It's really a community effort to drive health literacy forward and help to address health equity. So thank you so much for coming today and sharing your thoughts and feedback with us.
Thank you all.
Thank you so much, and happy Halloween.
You too.